Alright, so in this video I'm going to talk about the nerves and all of the muscles that are innervated by them. So as you can see, there's a lot. So before I talk about it on the diagram or on the body, I'm going to try to discuss it in like a flow chart that, I don't know, it's kind of confusing to understand, but if you bear with it, it's not too bad. Alright, so T12 is the first lumbar spine we're going to talk about. This is where the lumbar plexus comes from, so it goes T12, L1, L2, L3, and then the sacral plexus starts here, goes L4, L5, S1, S2, S3, S4, S5, and the coccygeal. Okay, so these are just different vertebrae in the spine. Okay, so now, to start off, T12 is the first one. It's going to go to the subcostal nerve. Okay, the subcostal nerve. Now T12 and L1 are going to come together and they're going to form the iliohypogastric nerve. That's going to be from T12 and L1. Now, L1 is the ilioinguinal nerve. The lumbar one is the ilioinguinal nerve. Okay, so now we have T12 and L1 done. Now L2. L2 gives some of its fibers and it connects to L1, so L1 and L2 join together, and this is the anterior division, and this is the genitofemoral nerve. That's L1 and L2. Okay. L2 also is formed, or comes together, converges. L1, L2, and L3 come together, and they form the superior clunical nerve. Okay. This is also the posterior thigh. This is the superior clunical nerve. L1, L2, L3. Okay. Now, L3, however, gets nerves from different fibers. We're going to start off with L2. L2 and L3 come together and they form the lateral femoral cutaneous nerve. So you can see L2 comes down and it joins L3 and they form the lateral femoral cutaneous nerve. Okay, now the accessory obturator nerve is the next one we're going to talk about. This nerve passes through the obturator foramen, right? And it comes from L2 and L3. So, where does that innervate from? Here's L2. And here's L3, right? I have it on L4, it shouldn't be. L2 and L3, and it forms the accessory obturator nerve. This is L2 and L3. Now, underneath this is the obturator nerve. The obturator nerve comes from L2, L3, and L4. Okay, it's kind of like the same order if you guys see. It's just like one down, another adds a new nerve. So now we have L2, L3, L4, L2, L3, and L4. They're going to join together and we're going to form the obturator nerve, right? Okay, the obturator nerve and the femoral nerve are going to come from the same nerve branches. Where does the femoral nerve come from? L2, L3, and L4. Same exact thing. Okay. Now, if we keep proceeding down, as I said, you lose a branch, you add a branch. It's in like a descending fashion, kind of. Okay. The nerve to the quadratus femoris, right? Or the superior gluteal nerve. They come from the same exact nerves. So the superior gluteal nerve is above it. So it goes superior gluteal and then nerve to quadratus femoris, right? But they come from the same innervation. And this innervation is L4, L5, and S1. So we have L4, L5, and S1. And what are they forming? The superior gluteal nerve. As you can see, L4, L5, and where else does it get its innervation from? S1, right over here. Same with the nerve to quadratus femoris. Okay. The next nerve we're going to talk about is the nerve to the piriformis. The nerve to the piriformis comes from two branches, S1 and S2. So S1 and S2, you could say S1, S2. So this is nerve to the piriformis, posterior side of the knee. Okay. Keep proceeding down, we have the inferior gluteal nerve, right? The inferior gluteal nerve also becomes the obturator internus nerve, right? It's the same innervations like we said from the other ones. Some of them have same innervations. Their innervations are L5, S1, and S2. Okay, so we have L5, S1, and S2. L5, S1, and S2, right? And they're forming the inferior gluteal nerve or the obturator internus nerve. Okay, Proceed down a little more. Adding, subtracting, right? We have the posterior cutaneous nerve. Posterior cutaneous nerve is S1, S2, and S3. S1, S2, and S3, right? Posterior cutaneous nerve. Okay. Now, the biggest nerve we need to talk about, right? This is the sciatic nerve. This comes from multiple vertebrae. He's coming from L4, L5, S1, S2, S3, right? All of these branches is a sciatic nerve. Sciatic nerve branches into two other nerves as well. He branches into the anterior and the posterior. An anterior region is going to be the tibial nerve, and the posterior region is going to be the common fibular nerve. Just have to kind of remember that. Also, we could also remember that the anterior tibial nerve is L4, right? L4 to S3. L4 to S3 is the anterior tibial nerve. Okay, good. Now the posterior is the common fibular nerve. He is only innervated by L4 to S2. Okay, so this guy right here is L4 to S3. And this guy right here is L4 to S2. Okay, my bad, the bad handwriting. Okay, now if we keep proceeding down, we don't have that many more. We just have the pudendal nerve, which is S2, S3, and S4. We have the pudendal nerve. And then we have the coccygeal nerve, right? The coccygeal plexus. This is just C4, C5. No, I'm sorry. S4, S5, and C1. I was reading upside down. S4, S5, and C1, where the coccygeal forms the coccygeal plexus. Okay, so these are all the nerves. I know it's kind of like a train track. It's kind of confusing, but if you just follow down the process, it all makes sense. I do have an acronym for you guys for a couple of them. So the first one is for the lumbar plexus, and then I'm going to have one for the sacral plexus. So for the lumbar plexus, right? The acronym is I twice got lost on freeways. Okay, so that means I-G-L-O-F, right? And this is not for every single nerve, but it's for the main important ones, right? So iliohypogastric nerve. I twice, so that means it's two I's. The second I is ilioinguinal nerve. Okay, so we have I check, good. Now G, so I twice got, G for got. Genitofemoral nerve, right here, right? Genitofemoral nerve, got. Lost, lateral femoral cutaneous nerve, right? Lost. What's next? Obturator nerve, right here. That's O. And F is the last one. Femoral nerve, right? Femoral nerve. You could add I twice got lost on a freeway to make it a little better. I twice got lost on a freeway, and then you could add accessory nerve. Accessory obturator nerve. So I, iliohypogastric. I, ilioinguinal. G, genitofemoral nerve. L, lateral femoral cutaneous nerve. O, obturator nerve. A, accessory obturator nerve. F, femoral nerve. Okay, the next mnemonic I'm going to talk about, I'm going to have to show you on a different board. I just want to give you guys one more mnemonic or one more acronym, right? And this is going to be for the sacral plexus. Okay, we talked about the lumbar plexus, the I twice, got lost on a freeway, I, G-L-O-A-F, right? Okay, so now for the sacral plexus, it's a little, I know this is going to look complicated. It's like kind of like Sudoku, a crossword. I didn't make this up. I got this from a YouTube video, and it kind of helped me a lot, so I just want to share it with you guys. But it's going to look confusing, but if you just go through the process like in a orderly fashion, it's going to make a lot of sense. So we know the sacral plexus starts at what? L4, right? And it goes all the way down to what? S4, right? Okay, even S5 we could say. Okay, so remember that's where it starts. So this is how we're going to draw our thing. We're going to start off at L4. And we're just going to draw the number 4, right? This is L4, remember that though. We'll start here, right? L4. And we're going to go down in an orderly fashion. Remember we had L4, then we had L5, right? L5, and then what? S1, S2, S3, S4, S5, right? So we have L4, L5, S1. Okay, now we're going to just match them. We're going to go 5. What's next? 1, 2. Okay, so L4, L5, S1, and now we have L5, S1, S2, right? L5, S1, S2. Okay, so now we're going to match the one underneath it in an orderly fashion, right? 1, 2, 3. S1, S2, S3. Okay, now we're going to go here. S2, S3, S4. One more time, we're going to match him, right? And what do you say? 3, S3, S3, S4, and what? S5, right? Okay, this looks really confusing. Just draw a box, it'll make sense. You draw a box like that. 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 So what am I doing? I'm just grouping them, right? I'm just grouping them. That's how they're supposed to be. Okay, so now, if we remember what L4, L4, L5, and S1 were, it's hard to remember sometimes, right? So we're gonna just take this away for now, right? And we're gonna write one more name, right? We're gonna write SIPS, not simps. Don't be a simp. SIPS, SIPPS. Never be a simp. Okay, no, I'm just kidding. SIPPS, right? S is the first one. It stands for superior. Remember we talked about the first one, superior gluteal nerve, right? Superior gluteal nerve. And what made up superior gluteal nerve? L4, L5, and S1. Okay, so that's L4, L5, and S1 is the superior gluteal nerve, the first nerve we talked about in the sacral plexus. Now, L5, S1, and S2, we have another one. Inferior gluteal nerve, right? Okay, S for superior, I for inferior. Gluteal nerve. Okay, keep proceeding down. S1, S2, and S3 made what? Something with a P. We know it's something with a P because we did SI. Now we have to do something with a P. Posterior. Cutaneous nerve. Right? Next one. S2, S3, S4. What did we make? Another one with a P. Pudendal nerve. Right? Now, the last one. It's an S, right? This is the big one. Did we have one that was S3, S4, S5? No. But we did have a big one that was more than 1 or 2 or 3, even 3 or 4 nerves, right? It was 5. It was L4, L5, S1, S2, S3. So, if we just draw a little diagonal, S4, S1, S2, S3, right? Like this. We have the main guy, the sciatic nerve. Okay, so this is how I am going to remember the different sacral nerves and the different lumbar nerves. So, it's I twice got lost on a freeway, and then it's this little sequence. You just have to remember it starts at L4 and it ends at S5, and then you could do everything from there. And just remember SIPS, not simps, SIPS. I know this looks like a lot, and it is, but I'm gonna explain it in full detail on like how every muscle like moves and functions, right? And I'm also gonna explain to you how the nerves that we spoke about branch down. I'm not gonna talk about all the nerves because I would not be able to draw this on the board. I could barely draw this. I'm gonna talk about the main nerves of the lumbar plexus and the sacral plexus, right? So here I have T12 to S5, which is basically the lumbar and sacral plexus. It is the lumbar and sacral plexus, the whole thing. Sacral starts here, lumbar starts up here, right? Okay, so first, muscles I didn't draw and nerves I didn't draw we're going to talk about quickly. We're going to start off with the subcostal nerve, right? This was from T12, and he splits into pyramidalis and the transverse abdominis. So, muscles up here, right? But we're only going to discuss the lower leg muscles, really. Next is the iliohypogastric nerve. He has two functions, a cutaneous supply and a motor supply. The cutaneous supply is the skin above the pubis and skin on the lateral buttocks, right? Your butt. The motor supply is for the internal oblique and the transverse abdominis. We don't have to worry about that yet. Now, the ilioinguinal nerve, right? It's mainly a cutaneous function. He does the skin on the proximal and medial part of the thigh. and he also does external genitalia. The motor function of him is for some of the internal oblique and transverse abdominis muscles, right? Okay, keep a little more. We have the genitofemoral nerve. The cutaneous supply is the genitalia, the anterior thigh, the superior to middle inguinal region. And the motor supply is for the cremaster muscle. Okay, a couple more. The superior clunical nerve, right? He's for the lateral buttocks and to the tubercle of the iliac crest. The lateral femoral cutaneous nerve, he's getting important now. This is for the lateral thigh and the peritoneum, right? This is for the skin of these regions. Now we already talked about most of the muscles and functions, right? We have the accessory obturator nerve, right? Accessory obturator nerve. He has cutaneous supply and motor supply. Most of these muscles are going to have both, right? Because Hill's law says whatever a nerve innervates, where the muscle is going to cross over a joint, has to innervate the same skin that goes over that joint. So if you're going to like over your hip joint, right, and you have muscles crossing your hips all the time, whatever nerve is stimulating those muscles crossing the joint, it has to stimulate the same region for the skin. That's just a law. I didn't make it. That's how it goes. It's like gravity. Okay, now the accessory obturator nerve, cutaneous, supply to the hip joint. Okay, so the skin around the hip joint. The motor is for the pectineus. The pectineus muscle now, this is not really exact, but it's as good as I could have done. The pectineus muscle is going to be right in here, right? And it's a small muscle right around the hip, and he helps flexion of the hip. So let's talk about flexion extension first before we talk about the rest of the muscles. What would be flexion of the hip? So if here's my body, right, and I go this way with my whole leg, I'm making my hip joint smaller. I'm flexing my hip, okay? And if I want to make it larger, like the angle, I would go backwards, and this would be extending the hip. This would be extending, this would be flexing the hip. So the pectineus muscle, since it's on the anterior side, we have to think anterior muscles, right? If they're contracting, they're making things smaller, of course, right? They're going to pull things upward, right? They're going to flex. And if you have a muscle like on the posterior side of the hip region and it shortens, your leg's going to go backwards, so it's going to extend. Okay, so that's what the pectineus does. Now we could talk about the obturator nerve, right? Okay, obturator nerve. What does he do? So we have to look at where he goes. Where does he start from? Everything like that. Obturator nerve comes from L2, L3, and L4, right? So L2, L3, and L4 is the obturator nerve. I drew him in like this ocean green color right here. It's hard to see, but if you could see it. He flows through, right? And he's obviously going to pass through the obturator foramen, right? Because that's what he does. The obturator nerve and the accessory obturator nerve pass through the obturator foramen. So he passes through the obturator foramen, right? And what does he reach? He reaches the soda nerve. He reaches the medial thigh region, and then he's going to reach the adductor longus. He's going to reach the adductor magnus, the adductor brevis, the gracilis, and the obturator internus. Okay, what do these muscles do and where are they? So, if they're an adductor muscle, what does adduct mean? I'm going to use my arm for an example. Adduct is to add to my body. I'm adding to my body. What would be abduction? Going away. So I'm abducting. This is adducting, to add. Abduct is to go away. Okay, so the obturator nerve, right? We know it's the obturator foramen, right? It's kind of like on the medial side of our hips. So it makes sense for it to innervate the medial muscles. Medial muscles are going to adduct. Okay, so we're going to start off with the adductor longus. I drew them all like over here because I couldn't really draw 3D. So you just have to like kind of know where they're in the medial side of the femur. So the adductor longus is going to adduct the hip. The adductor magnus is going to adduct the hip. The adductor brevis is going to adduct the hip. The gracilis, however, is going to do two things. It's going to adduct the hip, so it's going to add it, right? Adds. And it's also going to do flexion of the knee. So, what is flexion of the knee? Flexion, right? The knee joint's going smaller, and this is extension. So where is the gracilis going to be located if it's doing flexion of the knee? It can't really be on the anterior side, or else that would be extension. It's kind of got to be on the medial posterior side. We have to say medial because we know it's doing adduction, it's adding. And we say it's posterior, kind of, because it's doing flexion. Okay, so it's adducting the hip, it's flexing the knee, and it's doing one other thing. It's helping with medial rotation. What is medial rotation? Medial is to go towards the midline of the body, right? And if you're rotating the femur. You're rotating this right here, right? This joint. So if you're medially rotating, you're going inwards. Inwards. If you're doing lateral rotation or external rotation, it's outwards. But that wouldn't make sense because if the muscle's shortening, that means it's getting smaller. It's pulling it, right? So gracilis is on the inside. It's going to shorten, and it's going to adduct or internally rotate, medial rotation of my hip. Okay, so those are the muscles of the obturator nerve. The next one we can talk about is the femoral nerve, right? The femoral nerve has cutaneous and motor function, because most of these guys do. The cutaneous function of the femoral nerve has two regions. The anterior femoral cutaneous branch. He's anterior and a little lateral aspects of the thigh. So anterior and some lateral. And then the saphenous branch is going to be the middle hip joint. He's going to be the medial thigh. So medial thigh. Medial knee, so the knee, or popliteal. Medial calf, so the medial side of my calf. And it's also going to be the medial side of my heel. So everything on this this region, is going to come from the saphenous branch. Okay, so now, the femoral nerve has a motor function, right? Because they all do. Its motor function innervates a good amount of muscles. He does the iliacus, the pectineus, the quadriceps femoris, right? Sartorius. And what else did we say branched off the femoral nerve? It was innervated by the same thing? The nerve to the quadratus femoris. The nerve to the quadratus femoris is also going to stimulate the quadratus femoris and the inferior gemellus, right? So, let's talk about what these guys do and where they come from. Well, yes, he is drawn in brown, and he's coming down L2, L3, and L4, right? And he's flowing down to the femur. He branches off these muscles. I'm going to talk about the quadriceps femoris first because it's easier to discuss. The quadriceps femoris, it's kind of a muscle like this, right? It's our quads. It's the anterior side. And I'm going to draw right here, right? This is the middle, right? This is going to be the rectus femoris. Rec fem, right? And then this is the right leg. Pretend this is the right leg. So we're going to have a vastus lateralis. It's going to be on the right side, or the lateral side. We're going to have a vastus medialis, right? Inner side, medial side. And then underneath the rectus femoris, so if we were to rip the skin off, or rip the muscle off, we're going to have the vastus intermedius, right? Okay, so those four muscles make up the quad. And what do these muscles do? Okay. Vastus medialis, the inner one, right? It extends at the knee. Vastus intermedius, deep to the rectus femoris, extends at the knee. Vastus lateralis, extends at the knee. Now, the rectus femoris has one other thing. He's a little bit bigger, right? Rectus femoris, he's on top, he covers everything, right? He flexes the whole leg at the knee, right? So he's going to flex the whole leg this way, and he's also going to do what? Extend the knee. So he flexes the hip, and he extends the knee. Flexion of hip, extension of the knee, right? That's going to come from the rectus femoris. Now, I'm going to erase him, and I'm going to show you right here. I have it's hard to tell, but this is the rectus femoris, vastus intermedius, vastus lateralis, vastus medialis, and they're all getting innervated by what? The femoral nerve. And the femoral nerve is coming from L2, L3, and L4, just branching down. Okay. Now, however, they're not coming directly from the femoral nerve. They're coming from the nerve to the quadratus femoris. So we have to remember that. We have to remember the femoral nerve has all these innervations, but the quadratus femoris does all of the work, like the nerve for the quadratus femoris. So the quadratus femoris, however, is L4, L5, and S1. It's this pink fiber that comes all the way down, and this pink fiber is really doing the main innervations to the quadratus femoris. The femoral nerve doesn't innervate the quadratus femoris, it's just in the same subsection of the quadratus femoris. Okay, so now the iliacus and the pectineus, what do? The iliacus and the pectineus are up here, and all they do is flexion of the hip. So they help flex the hip. They come from L2, L3, and L4. Okay, now, the one more I want to talk about is the sartorius muscle. The sartorius muscle comes from the lateral side of the femur, and he goes to the medial side of the femur. What does he do? The sartorius flexes the leg at the hip, right? Because he's from lateral to medial. If it shortens, he's going to flex the hip. What else is he going to do? Well, if it's lateral to medial, he's going to externally rotate, right? Because he's going to pull the leg away. And he's going to extend... No, that's it. External lateral rotation of the knee. Okay. Now, we have a couple more muscles to talk about. We're going to talk about mainly the cervical plexus side. That was the lumbar plexus. Here's the cervical plexus. The lumbar plexus is going to be the superior gluteal nerve, and he's going to have different functions. Mainly, these are motor. We have some cutaneous, but the cervical plexus is a lot more motor than the lumbar does. Superior gluteal nerve is going to branch into the gluteus medius, gluteus minimus, and tensor fasciae latae. Okay, and now the inferior gluteal nerve is going to branch into the gluteus maximus. Okay. This is the posterior side of the leg, right? Same right leg, just as posterior. First one I'm going to talk about is the inferior gluteal nerve. He's blue. He's L5 to S2, right? And he's just going to innervate the gluteus maximus. This is the butt cheek, right? One of them. What does the gluteus maximus do? So if it's behind, it's going to extend the hip joint, right? And it's also going to do lateral or like external rotation of the hip. Lateral external rotation. Okay. Now, the superior gluteal nerve innervates three different muscles. Superior, he's above, right? And he's coming from L4, L5, and S1. He's going to innervate the gluteus medius, the top one right here. He's going to abduct the hip. Okay. Abduction of the hip. Not adduction. Abduction of the hip. Abduction. The gluteus minimus is going to do the same thing. Abduction of the hip. And then the tensor fasciae latae, the TFL. I have him here. He's pretty deep. He's supposed to be more more lateral. He also extends. No, he does flexion at the hip, and he also does medial rotation, right? So he flexes the hip, and he works with medial rotation. That's what the TFL does. Now, we have the obturator internus nerve. The obturator internus nerve passes from L5 to S1, S2 through the obturator, right? And what is he going to do? Motor supply. What does he motor supply with? The obturator internus and the superior gemellus. Okay, here we have the obturator internus and the superior gemellus. They do lateral rotation. They both do lateral rotation of the leg. So they laterally rotate the leg. Now, the posterior cutaneous nerve, however, this is one of the cutaneous ones. It's the inferior butt and the posterior thigh or knee calf. Inferior butt, posterior thigh, posterior knee, posterior calf, and posterior heel, right? That's the skin layers it's going to cover. Now, this green fiber right here, I have them coming anteriorly and posteriorly, right? This is anterior, that's posterior. This is the sciatic nerve. We said the sciatic nerve branches into two regions, tibial and common fibular. Okay, let's talk about the tibial side first. The tibial side has a cutaneous and a motor, and the cutaneous is for the whole entire posterior leg, so the whole posterior of my leg, and the soleus of my foot. That's what the tibial nerve is for. Okay? He does a lot of things. He does the hamstring, biceps femoris long head, semitendinosus, semimembranosus, adductor magnus, popliteus, plantaris, tibialis posterior, flexor digitorum longus, flexor hallucis longus, the triceps surae, which is basically the gastrocnemius, medial and lateral heads, and the intrinsic muscles of the foot, and the soleus, Okay, so first, we're going to talk about the biceps femoris long head, the semitendinosus, and the semimembranosus. These are the hamstring muscles. They're the back of the leg, right? So, we have sciatic nerve coming down, right? And we have the tibial nerve, right? What is he doing? He's innervating these muscles. And what do? They extend at the hip, so they're helping with extension of the hip, right? But what do they also do? Since they're connected from the knee to the hip, they flex the knee. These muscles flex the knees. The quads extend the knees, the hamstrings flex the knees. Okay, if we continue down the adductor magnus, we said adductor adds to the body, abductor goes away. So this is adding back to the body. Now, we have the popliteus and the plantaris, right? They're going to be right in the back of the tibia, right? And what are they going to do? They're going to both do plantar, they're going to do flexion at the knee, right? So they're going to flex the knee to unlock the knee joint. So the knee joint's locked, so these two muscles help flex the knee to unlock it. Keep proceeding down. We have the tibialis posterior. He's going to do plantar flexion, and then inversion of the foot. This is inversion, this is eversion. This is inversion, this is eversion. So they plantar flex and they invert the foot. Okay, a couple more. We have the flexor digitorum longus. He's going to do flexes the digits, and he's going to do inversion of the foot as well. He's going to plantar flex the foot. Now, we have the flexor hallucis longus. I'm not even going to show it on the diagram, it's hard to see, but the flexor hallucis longus, he's going to flex. So to continue, we're going to talk about the triceps theri, which is the gastrocnemius and the soleus muscles. So the gastrocnemius, we have the medial and the lateral side. They just help with plantar flexion. They help plant the foot down, right? And then we also have the soleus. The soleus also aids in plantar flexion. It's underneath the gastrocs. Can't see it in this diagram. Okay, so now, the posterior side, we have the common fibular nerve, right? The cutaneous function of him is the lateral aspect of the thigh, knee, and calf, right? That's what the common fibular nerve is. The motor portion, he has a few muscles too. He has the biceps femoris short head, the fibularis brevis, also known as the peroneus, fibularis longus, extensor hallucis longus, extensor digitorum longus, and tibialis anterior, right? Okay, so we're going to go on this side for him. We'll do the biceps femoris short head first. He's right over here, right? The most lateral one. And he also does what? He helps extension at the hip and flexion of the knee. So extension of the hip and flexion of the knee. Okay, so now the fibularis longus and brevis, they're on the fibular side, right? Branching off of the common fibular nerve. And what are they going to do? They're going to do eversion of the ankle. So it's on the fibular side, it's on the far side, and it's just going to evert the ankle. Eversion, right? Okay, now, the extensor hallucis longus, he's going to just extend the big toe, extension of the big toe. The extensor digitorum longus, he's going to do extension of the digits and dorsiflexion. So dorsiflexion is basically like this. It's extension almost. And then we have the tibialis anterior, which is going to do dorsiflexion of the ankle. And he's also going to help with inversion. Inversion is this way. Extensor digitorum longus also helps with inversion this way. Okay, we have one more thing to cover, the nerve to the piriformis. The piriformis is on the outside. He does lateral rotation. And then we have the pudendal nerve, right? The cutaneous is the entire perineum, but the motor, he's going to just do the external anal sphincter and the external urethral sphincter. This helps you not do number 2 or in your pants or number 1 in your pants. Like, it's gross, but that's what these muscles help for. And that's basically it. But I want to go over one more time quickly what I discussed with the quadriceps femoris. The quadriceps femoris muscles, right? They're innervated by the quadriceps femoris nerve, right? And the quadriceps femoris nerve, or the nerve to the quadriceps femoris, is L4, L5, and S1. So L4, L5, and S1, right, comes down through over the acetabular, or the obturator foramen, and he's going to branch into the quadratus femoris nerves. They're the rectus femoris, vastus lateralis, vastus medialis, and the vastus intermedius is underneath, right? So what do these muscles do? These muscles help extend the knee. That's basically it for the quadriceps femoris nerve. And that's all the muscles and nerves of the body. That's what we need to know about him. So I hope this video helped, and